Hello everyone, I'm Marlene Kamangyan, your student nurse. So for today's video, I'll be showing you how to properly assess the posterior parts of the thorax and the lungs. So without further ado, let's get started. Good afternoon sir, I'm Marlene Kamangyan, your student nurse from Union Christian College. For verification po sir, may I know your name?
My name is Raven Beninsig.
Birth date po.
July 22, 2002.
Age po.
Age 19.
Okay po sir. So, kunting interview lang po para sa subjective data. For the current symptoms, may difficult po ba kayo sa paghinga?
No.
How about sa chest pain po?
Wala po. No.
How about sa cough po?
No.
Sa past history po, may prior respiratory problem po ba?
No.
How about previous thoracic surgery or biopsy?
None.
How about sa allergy? May mga treatment po ba tayong ginagamit or medications?
None.
Sa pulmonary studies test, nagkaroon na po ba kayo ng x-ray or skin test po?
None.
For the family history, meron po bang lungs disease na family history po?
None.
For the lifestyle and health problem po, gumagamit po ba tayo ng tobacco products or cigarettes po?
No.
How about sa exposure sa environmental conditions, meron po ba tayong exposure na nakaka-apekto sa breathing such as secondhand smoking po?
No.
Sa difficulty po, meron po ba tayong performance difficulty performing in our usual daily basis?
None.
How about sa stress po? Na-stress po ba kayo, sir?
No.
Sa medications po sa breathing, meron po bang prescribe ang doktor sa inyo?
No.
Okay, sir. For assessment for today, I'll be assessing your thorax, particularly posterior parts of the thorax and also the lungs po. For this assessment, kinakailangan ko pong i-inspect, palpate, percuss, and auscultate sa inyong mga breath sounds po. It's okay with you, sir?
Yes.
So, let's assure all of the document is completely confidential between me and the attending physician that I'm referring you. Okay po ba yun, sir? Okay po, sir. Kunin ko lang po yung patient's gown para makapagpalit na po kayo ng patient's gown. Ito na po, sir. And mag-hand hygiene lang po ako. So, I already told the patient to change his clothes into the patient gown. And I already performed the hand hygiene. And I already closed the curtain to provide privacy of the patient. So, for the first one, I'll be inspecting the shape configuration of the chest wall as well as the position of the scapula. Okay po, sir. And I will also be inspecting of the accessory muscles and pusher of the patient. So, sir, can you please inhale, exhale po? Okay po. When I ask the patient to breathe, I observe that he uses his shoulder as an accessory muscle in exhaling and inhaling. For the next one, I'll be palpating the tenderness and the sensation of the patient. So, okay po sir, palpate ko lang po yung back nyo po. Masakit po ba sir?
It's lang all good.
Okay po sir. So, wait lang po, mag-hand gloves lang po ako. also I'll be inspecting for the temperature using the dorsal part of my hand. For the scapula, it is symmetrical and I haven't seen any reduction. For the shoulder and scapula, it is equally horizontal position and posterior back of the patient. And I also haven't seen the sign of ecchymosis and scoliosis or any misalignment in the spinal cord of the patient. So sir, can you please inhale, exhale po? Okay po. When I ask the patient to breathe, I observe that he uses his shoulder as an accessory muscle in exhaling and inhaling. And the temperature is equally bilateral as I observe. And catch the patient's back using the dorsal parts of my hand. It is warm and it's not too hot. The client said that he is no pain. Palpate it and observe it that I haven't seen feel any tenderness. Next one, I'll be palpating the primitus and I'll be using the ulnar parts of my hand. Sir, so can you please say the word 99 to me as I touch it?
99, 99, 99, 99, 99, 99, 99, 99.
And the next one, I'll be observing the chest expansion for me to observe that using the thumb of my hand at the T9 and T10 of the patient. So sir, can you please inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. For the primitus, I have observed that it's symmetrical and I can feel the vibration when the patient say 99. There is present of vibration as I palpate it up until this one. The next one, I will percuss the intercostal spaces of the patient. So sir, allow me to percuss your back. Oh. So I observe that resonant, the dullness and the flatness as I percuss the back of the patient. And also I'll be percussing and performing the diaphragmatic excursion. Okay po sir, can you please inhale po? Exhale. Okay po sir. And next one po, can you please inhale and move lang po. Okay po. The next part of the assessment and the last part, I'll be auscultating the breath sounds of the patient and observe any possible if there is any presence of abnormal breath sounds. So please sir, allow me to auscultate your breath sounds using my stethoscope. So the next one, I'll be observing and auscultating the voice sound of the patient and the chest wall. So, pakisabi na lang po na namin pag naramdaman ko po ng stethoscope. one, I'll be auscultating the egopony of the patient. Can you please say letter E po, sir?
E. 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 E.
And for the last one, I'll be inspecting for the whispered pictorilogy. So, that's it for today, sir. Thank you for your cooperation. Have a nice day po.